A patient walks into your clinic and says, डॉक्टर जो आपने एस्टिमेट दिया था 20,000 का, उसको कुछ कम कर लो प्लीज. हम लोग सारी फैमिली आपके पास आते हैं, कभी आपको कुछ नहीं कहा. all our family comes to you. We haven't even said once to you. The question is, will you stoop to patient's choice of bargaining? Will you bow down to patient's choice of bargaining? Yes or no? Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist with 23 plus years of experience, and along with dentistry, I'm training and coaching colleagues on the topics of practice management, medical legal aspects, ethics, consent, and finances in dentistry. So in this video of mine, I'll be divulging a little bit about whether we should bow down to patient's request or patient's choice of bargaining or not. The number one pivotal point in this is that we need to understand if the patient is via word of mouth marketing to us, then slowly and steadily over a period of years, we lose our power of bargaining with such patients. We get into that fearful mode that if we say no, we'll lose the patient. So थोड़ा सा कम कर लो, 5-10% डिस्काउंट दे दो, क्या होता है तो पेशेंट चले जाएगा. That 5-10% you are reducing will eat up into your profits. You have to understand primarily there is a way to say a no, and you have to do that respectfully without hurting the patient. It does not mean that you will always say no, our charges are very fixed, we won't reduce them. You don't have to sound like a adamant boss. You don't have to sound like a whimsical person in that regard. Sound like a true professional. And of course, there are ways to refuse it. You can always say that we don't want to compromise on the quality. So if you want to reduce prices, there will be somewhere I'll have to cut corners to make ends meet, which I surely would not want to do to a very, very loyal patient of our clinic. So, and you all know we are living in a world of inflation. Everything is getting costly day by day. So I would not recommend that to ask for that. Yes, I will try to cover up in some way or the other. By this way, you are creating a common ground that yes, we will be willing to offer something in kind, giving a sample of a brushing kit, giving a sample of a mouthwash or whatever. I'm just giving an example, not necessarily these things, but these are a few things you can deliver, say in a nice tone, respectfully, without hurting them, and of course, still honoring their request as per their choice. Because once you try to, you can say, go down, you have to understand you will spread the word that this doc is prone to bargaining, and that will be a very wrong word to spread about you. Secondly, when you start on an even background, you need to detail everything first, have a proper consent form, and like as they say, we need to mention each and every detail verbally first, and then we put it on the consent form. And of course, consent form would include the treatment charges also, the treatment payment protocol also. So don't eat into your profits, because it is really an inflationary world, and don't spread the word also about you. And that brings me to the point which I told you at the start. Word of mouth referral. Word of mouth referral is not bad at all. But if it is the only way of getting patients into your practice, you need to give it a second thought, because it will make you lose your bargaining power over the patient in the longer. Thank you so much for watching this video. If you like this video, please do share with friends and colleagues. And I see you in another video of mine very, very shortly. Bye-bye. Take care.